The thyroid, lovingly nicknamed the butterfly gland, is small but packs a powerful punch, controlling your metabolism, energy, and even body temperature. Nestled at the base of your throat, this tiny gland is a superstar in the endocrine system. But here's the catch. Thyroid cancer often hides in plain sight, showing few signs until it's advanced. Spotting the warning signs early is a game-changer. Quick action can make all the difference. Let's uncover the red flags you should never ignore. Number 10. Lump or enlargement in the neck. Thyroid nodule. One of the hallmark signs of thyroid cancer is the presence of a palpable lump or nodule in the neck. Thyroid nodules are relatively common, occurring in about 5 to 10% of adults globally, but only a small percentage are cancerous. These nodules are typically painless, firm, and located below the Adam's apple. They may result from abnormal growth of thyroid cells or fluid-filled cysts. Differentiated thyroid cancers, including papillary thyroid cancer, constitute about 90% of thyroid cancer cases, with papillary thyroid cancer alone accounting for 85% of diagnosis. In iodine-deficient regions, nodules are more prevalent, emphasizing the importance of iodine in thyroid health. If you notice a lump or swelling in your neck, consult an endocrinologist for an ultrasound or biopsy to determine its nature. Number 9. Hoarseness or voice changes. Changes in your voice, such as persistent hoarseness, may signal thyroid cancer, particularly if the tumor is pressing against the recurrent laryngeal nerve. This nerve controls vocal cord movement, and interference can cause difficulty speaking or a raspy voice. These changes are often subtle at first, but become noticeable as the tumor grows. Studies indicate that voice changes are present in about 25 to 30% of thyroid cancer patients, especially in advanced stages. It's important to note that smoking and excessive alcohol use can exacerbate these symptoms by damaging the vocal cords. To maintain vocal health, ensure proper hydration, avoid strain, and consume foods rich in vitamin C and antioxidants, such as citrus fruits and leafy greens. Persistent voice changes warrant evaluation by an otolaryngologist or thyroid specialist. Number 8. Difficulty swallowing, dysphagia. As thyroid cancer advances, it can invade nearby structures such as the esophagus, trachea, or larynx, causing dysphagia. This condition may feel like food or liquids are getting stuck in the throat, leading to discomfort or choking. Medical research has shown that 10 to 15% of patients with advanced thyroid cancer experience dysphagia as a primary symptom. Dysphagia may also be accompanied by weight loss and malnutrition if left untreated. Imaging studies like barium swallows or endoscopies can help identify the extent of esophageal compression. If difficulty swallowing persists, early intervention is critical, as delayed treatment can result in complications like aspiration pneumonia. Number 7. Persistent cough. A chronic, unexplained cough that doesn't respond to standard treatments could be a warning sign of thyroid cancer. The tumor's proximity to the trachea often results in irritation and coughing. While most cases of persistent cough are linked to conditions like allergies, asthma, or acid reflux, approximately 5% of thyroid cancer patients report a chronic cough as an initial symptom. Using a humidifier, drinking warm herbal teas, and avoiding environmental irritants like smoke can alleviate discomfort. However, persistent coughing, particularly when coupled with other symptoms like neck pain or difficulty swallowing, necessitates medical attention. Chest X-rays or CT scans may be required to assess lung involvement if the cancer has metastasized. Number 6. Neck pain or tenderness. Neck pain, particularly in the front, is another symptom to watch for. This discomfort may radiate to the ears or jaw if the tumor spreads to nearby nerves or tissues. Studies have shown that up to 20% of patients with medullary thyroid cancer report neck pain before diagnosis. Pain severity varies, ranging from mild tenderness to sharp, localized aches. Applying warm compresses and taking over-the-counter pain relievers may offer temporary relief, but persistent or worsening pain should be evaluated. Imaging techniques like MRI or CT scans can help pinpoint the source of the discomfort and assess potential cancer spread. Number 5. Swollen lymph nodes. Swollen lymph nodes in the neck, under the jaw, or behind the ears are often a sign that thyroid cancer has spread to the lymphatic system. Lymph nodes are part of the body's immune defense, and their enlargement can indicate an ongoing fight against infections or cancer. Studies suggest that 30 to 50% of patients with papillary thyroid cancer show lymph node involvement at diagnosis. Enlarged nodes may feel firm and immobile, distinguishing them from those swollen due to common infections. If swollen lymph nodes persist for more than 2 weeks, an ultrasound-guided fine needle aspiration biopsy may be needed to rule out malignancy. Number 4. Difficulty breathing, dyspnea. Difficulty breathing, or dyspnea, can occur when a thyroid tumor compresses the trachea, narrowing the airway and causing shortness of breath. Advanced cases of thyroid cancer may involve lung metastasis, reducing oxygen levels in the blood. Research indicates that dyspnea is present in approximately 10 to 20% of cases involving large thyroid tumors or metastasis. Post-surgical complications, such as swelling or scarring, can also contribute to breathing difficulties. Pulmonary function tests or imaging studies can help assess the extent of airway compromise. Early detection and treatment can significantly improve respiratory outcomes. Number 3. Fatigue and weakness. Persistent fatigue and muscle weakness are common among thyroid cancer patients, often due to hormonal imbalances or the body's response to cancer. Treatments like thyroidectomy or radioactive iodine therapy can exacerbate these symptoms by altering thyroid hormone levels. Studies reveal that 70 to 80% of cancer survivors experience fatigue, with thyroid cancer patients being particularly vulnerable. Incorporating a nutrient-dense diet with foods rich in iron, magnesium, and B vitamins can help combat fatigue. Physical activity, such as walking or yoga, may also improve energy levels. If fatigue interferes with daily life, consult a healthcare provider for tailored interventions. Number 2. Unexplained weight loss. While less common, unexplained weight loss can be an indicator of thyroid cancer, particularly in its later stages. This occurs due to increased metabolic activity, hormonal changes, or reduced nutrient absorption caused by tumor growth. Research shows that approximately 10% of thyroid cancer patients experience significant weight loss as a symptom. On the other hand, treatments like hormone replacement therapy may slow metabolism, leading to weight gain. Regular monitoring of weight fluctuations, combined with a balanced diet and exercise regimen, can support overall health. If unexplained weight changes persist, a thorough medical evaluation is advised. It's also important to stay hydrated and include foods that support thyroid function, such as those rich in iodine, selenium, and zinc. If unexplained weight changes persist or are accompanied by other symptoms, a thorough medical evaluation, including blood tests and imaging studies, is strongly advised to identify and address any underlying causes promptly. Number 1. Loss of appetite. A reduced appetite, especially in advanced stages of thyroid cancer, may result from tumor-induced hormonal imbalances or physical pressure on the digestive tract. Loss of appetite can lead to unintentional weight loss and nutrient deficiencies if not addressed. Studies suggest that anorexia is a symptom in 15 to 20% of patients with advanced cancers, including thyroid cancer. Physical discomfort, such as a sensation of fullness, may further contribute to appetite suppression. Nutritional counseling and supplements may help maintain adequate calorie intake during treatment. Persistent appetite loss should be evaluated to determine the underlying cause and ensure appropriate care. Early detection can save lives, so if you or someone you know is experiencing any of these symptoms, don't hesitate to seek medical advice. If you found this video helpful, make sure to give it a big thumbs up. Your support means the world to us. Don't forget to hit that subscribe button and turn on the notification bell so you never miss out on our latest health videos.